Well, thank you so much to NIAA for asking Minnesota to come and talk about our plan. It is exciting, and I hope that this presentation will give you all some ideas that you can take back to your state. If not your state, then your town or your county or some place where you can start talking to folks on all sides. We all know that the problem of antibiotic resistance affects everyone. It affects folks in hospitals, it affects folks in nursing homes, it affects the farm, and oftentimes the news is scary and inaccurate. And we know this. And so it was actually the state epidemiologist of Minnesota who decided that primarily at the start of it, through her connections with people in Department of Ag, Pollution Control Agency, and Board of Animal Health, she decided that she was going to explore the idea of doing something about it. Fighting resistance, as we've seen these four points multiple times over the last couple days, but fighting resistance is encompassed by preventing infections, tracking infections, improving prescribing, which we call stewardship, and developing new drugs and diagnostics. And a lot of the talk that we've had over the last few days is about this improving prescribing and improving stewardship. And that's what we have been focused on in Minnesota. Prior to starting this One Health initiative, the Minnesota Department of Health had a fairly long history of working on stewardship efforts in human health care. And back in the early 2000s, Minnesota put together an antibiotic resistance collaborative. And through that collaborative, they put out guidance and had activities for outpatient and long-term care settings. And in 2012 and through 2014, they started to have stewardship meetings where folks from human health care in the state came together, discussed stewardship issues, and decided how could they really improve the quality of their organizations. And a lot of this was driven by the strive for quality improvement in human health care. Quality improvement is a concept that now is well known in human health and is reported on publicly and is connected to reimbursement from Centers for Medicare and Medicaid Services. And so there was a big push to improve stewardship, and Minnesota Department of Health tried to provide a forum to do that in human health care. They developed two guidance tools, one for acute care stewardship programs and one for long-term care stewardship programs. But what they found was that there still were challenges. There were challenges in getting these tools that the Department of Health spent time putting together to the appropriate facilities, and there was also a poor understanding of what was happening in other sectors outside of human health care. Animal health stewardship in Minnesota is not new either. We've talked a lot over the last few days about quality assurance programs, producer and veterinary education programs, including both residue prevention and understanding the legal obligations, and veterinary accreditation, continuing education from the Minnesota Veterinary Medical Association. And we do have antibiotic use guidelines developed by various veterinary groups that are species-specific. And the American Veterinary Medical Association Stewardship Committee has been working towards putting out guidance for veterinarians. And so what about the environment? In Minnesota, we have routine surveillance from Minnesota Pollution Control Agency and surveillance of drinking water by the Minnesota Department of Health. And we do know in our state that antibiotic residues are found in groundwater, lakes, and streams, and it's a variety of antibiotics in their metabolites, from macrolides to fluoroquinolones to sulfa drugs and other drugs used in agriculture. Complex mixtures in the environment are both antibiotics and their metabolites, and it is complicated and it's a science of its own. We know that the contribution to antibiotics in the environment comes from both urban and agricultural settings. And we know that we really have to consider how antibiotics are disposed of, whether it's in human households, companion animal veterinary clinics, agriculture. What is happening to these antibiotics when they go to the septic, or if they are put in landfills, or when manure waste from agricultural settings is used in other agricultural settings like on fields, etc. The outstanding questions that we have about antibiotics and resistance in the environment are many, and they include how do antibiotics in the environment influence overall resistance, how does antibiotic exposure impact ecology, and how does it impact human health, and what can we do to mitigate the impact on the environment. In the summer to fall of 2015, the decision was made to put together a steering committee and really focus on this One Health approach in a concrete way. The definition that folks were using to work from was that One Health is a recognition that human, animal, and environmental health are interconnected. And the goal was to work collaboratively across all sectors to improve the health of everyone. The One Health planning process, I've got a few slides that show what was done in Minnesota. And this is just our experience. Certainly, to date, has worked well for us, and we have a lot of willing participants. I'm sure there are different models, but I'll just talk to you a little bit about what was done in Minnesota. The first step was to put together a steering committee. The steering committee, and this was all, I should say, all of this was driven through the Minnesota Department of Health, through the state epidemiologist, and really the day-to-day work was carried out by a fellow that the Department of Health had that was funded through CDC. A steering committee of about 20 people was put together, and this included folks from the Health Department, Pollution Control, Minnesota Department of Agriculture, the university, as well as practitioners in human and animal health. And they decided that they wanted to put together a meeting, a summit, for all that would be representative of all stakeholders in the state. Prior to that summit, they decided that they wanted to have individuals that would be attending do some quote-unquote homework so that we could really hit the ground running. What is it that you think is the most important priority in your field with regard to resistance or antibiotic use? What do you think the long-term vision, so moderately long-term vision, is in 3 to 5 years? What do you think the immediate next steps are in the next 1 to 2 years? What do you think the gaps are and the barriers to these problems? On January 19th of 2016, that meeting happened, and there were about 115 attendees at that meeting, representatives from human health facilities, hospital networks, from animal agriculture, producer groups, producers themselves. We also had scientists from the University of Minnesota. We had people from multiple agencies, and we also had representation from the governor's office. The meeting objectives for that summit were to understand, and now in hindsight, looking back, this objective seems a little bit large, but to understand antibiotic use, antibiotic stewardship, and antibiotic resistance from the human, animal, and environmental perspective. And that doesn't mean to understand it, entirely, but it was to expose people from different fields to what was happening in the other fields, to share best practices and lessons learned, and to develop strategic priorities to inform a 5-year antibiotic stewardship strategic plan. Participants at the summit, as I said, were state agency representatives and then stakeholders from all fields that use antibiotics or are impacted by antibiotic use. How, on that day in January, was the problem communicated? It was communicated in words similar to these: that human, animal, and environmental health are inseparable, that all antibiotic use leads to resistance. There is some contribution from every field that utilizes antibiotics, whether it's small or large. There is a contribution that is not zero from each of these fields. Lack of proof of harm is not an argument for using antibiotics irresponsibly. Greater abuse in other disciplines is also not an excuse for injudicious use in your discipline. And there are certainly unreasonable critics. There are unreasonable critics who exaggerate the harms of antibiotic use in certain fields, and they fail to acknowledge the real benefits. And you in this room, you all know this, that there's an exaggeration of the harms of antibiotic use in animal agriculture, and there is oftentimes a failure to acknowledge what the real benefits are, primarily animal health. And we did acknowledge that behavior change is key. The overriding message was that antibiotics are a shared resource, and optimizing their use benefits everyone. Antibiotic stewardship, what was it when we were talking about it at this meeting? It's the process of improving antibiotic use, recognizing that the importance of antibiotics and that they're essential to all aspects of health. They are a shared resource. The focus is on optimizing use, not withholding antibiotics, not withholding the use of antibiotics. And the goal is to optimize the selection, choosing the right antibiotic and using it at the right time, the dose, giving the right amount, and the duration, giving the antibiotic for the right amount of time. Stewardship certainly is a balancing act. In all fields, whether it's human medicine or companion animal medicine or animal agriculture, it's a balance between prescribing and not prescribing. There are unintended consequences on both sides. On the prescribing side, the unintended consequences could be toxicity, adverse drug events, the risk of developing a severe infection, for example, in human medicine, Clostridium difficile, the emergence of resistance, and of course, cost. The risks on the side of not prescribing include having untreated infections, more severe infections, disease spreading in a population, diagnostic uncertainty, negative patient or client relationships, and potential litigation. These are things that are true for all fields. What was the agenda on that day? At first, there was a welcome, and the first welcome came from the state agency commissioners to show that Health, Agriculture, Pollution Control, and Board of Animal Health were all on board for this. We had welcome videos from U.S. Senator Al Franken and also from Representative Colin Peterson. They couldn't be there in person. They would have been had they been able to. But they did record videos specifically for that day that said, we support you as you all come together for Minnesota to work out this really thorny problem. There was an overview of perspectives from the human, animal, and environmental health sectors, followed by a Q&A. And this part was just like, where are we with regard to stewardship in our field? Technical talks then from scientists, primarily at the University of Minnesota. What do we need to know about the science in each of these areas? And then Q&A. The next session was led by a moderator, and what the goal was to actually identify common goals among human health, animal health, and folks involved in environmental health. What are the fears that you have around resistance and antibiotic use? What are the wants that you have around these topics? How can we identify the priority activities and outcomes and resources and barriers with regard to these fears and wants? Those priorities, activities, and outcomes were sketched out in breakout sessions. And the way that the breakout sessions were formed was just by people deciding to move to the area where they felt it was most pertinent to them. When people came in the morning, they were all mixed up. There was assigned seating. There were people, mixed at different tables based on the desire to cross-pollinate. But then when the breakout sessions happened, we had folks move to areas where they thought that they had the most insight, input, or needed the most guidance. And then there was a wrap-up at the end of the day. What did we learn at the summit? We learned that there are definitely wants and fears in both of the groups, and these are just the top wants and fears. The top want was collaboration, common goals, recognizing both alignment but also recognizing differences. Decisions must be made on unbiased data, not on politics or public perceptions. Minimizing environmental contamination for safe food and water supply. People didn't want to have concerns about resistance, infections, or adverse effects. And they wanted a community understanding and informed participation from the community. What were they afraid of? People were afraid of ineffective antibiotics, untreatable infections, death, and adverse events. They were also afraid of reactionary decisions that weren't based on science and based on incorrect assumptions. They were afraid of overregulation, replacing careful medical assessment. And that's a fear not just on the animal side, but on the human side as well. And they're also afraid of negative impact on environment and the ecosystem. What did we learn from the summit? Well, certainly the significant preparation that went in prior to the meeting was essential. We came in with answers to those questions about what people thought was important, what people thought the barriers were, and that was a great starting point. The steering committee putting together a steering committee of people from different fields enabled ownership by all of the fields. And it also enabled us to get people to the meeting because we had someone on the steering committee who could directly link to them and directly relate to them. The collaborative design of the agenda, the language used, the people who were there, it all allowed for a really collaborative spirit. There were a range of meeting techniques that were used to try to encourage collaboration. The first, as I mentioned, was mixed table assignments, just getting people in the room and chit-chatting with people. Hi, who are you? What do you do? And then having those presentations at the beginning that showed the perspective from each of the fields, and also the scientific talks. That allowed us to see what are the real problems out in the real world, or the real issues for resistance and for stewardship, but then also, what is the science? What do we know? Where are we? Regular report outs were done on a screen while the meeting was going on, so that everyone could see transparently what was happening, what was being said, and also if there was something inaccurate, someone could reach out for correction. We did have a dynamic expert facilitator, someone who was known, primarily he's known in the veterinary and public health community, but known to know how to work the crowd, but also know the science and know how to engage people from different areas. So after that summit, January through June of 2016, the sort of summit summary was sent out to all participants, and then we asked for folks to participate on an ongoing basis in a technical work group to put together the actual 5-year strategic plan based on the outcomes of the summit. What is the strategic plan? This is it. The mission of the strategic plan is to provide a collaborative environment to promote judicious antibiotic use and to reduce the impact of resistant pathogens of human, animal, and environmental health importance. And the vision is just that Minnesota leaders continue to work together to raise awareness and change behaviors to preserve antibiotics and treat infections effectively. And it's important that, as we've talked about over the last 2 days, this vision includes not just preserving antibiotics, but also treating infections. The strategic plan has 4 goals. Promote the understanding of One Health, stewardship across the disciplines. What is One Health? What is stewardship? Improve human antibiotic stewardship, improve animal antibiotic stewardship, develop an antibiotic footprint tool to improve our understanding of the environmental impact on resistance. And I think it's important to point out while we're on this slide that yes, this is a One Health approach. This is a One Health approach, which means we have partners from everywhere. And we bring them together, we learn from each other, we know what is working in your unit, in your field, and how that might influence some gap that I have in my field. It really is a One Health approach. But the truth is, as we move forward day to day in our jobs, we have a responsibility to our sector. We have a responsibility to our sector to move, say, human stewardship forward so that we can comply with Center for Medicaid and Medicare Service changes. We have a requirement in animal agriculture to comply with the FDA, VFD, and there are different needs for those sectors. And so that's why we have goals that include both the general concept of One Health, how do we continue that, but also how are we going to move stewardship forward, because we know that we need a focus on those field-specific activities. I'll just briefly go through the activities that are listed in the strategic plan under each of these goals. For One Health, we really wanted to create an online source where people could go to for information and progress in any of the fields. Develop an antibiotic stewardship communications plan. That includes email bulletins, which have already started, and will include a lot of different activities as the 5 years moves forward. We want to hold in-person exchanges among practitioners in the different areas, and also, if possible, hold exchanges for general public individuals. We want to support public engagement in a broad sense on the One Health antibiotic stewardship mission, and also support One Health antibiotic stewardship curriculum in our health fields. Goal 2, improve human antibiotic stewardship efforts. We want to make tracking tools available on a shared resource. And those of you who are in human health, and those of you in ag and animal health, it really is pretty much the same. Tracking is hard. Tracking is difficult. So when we say make stewardship and antibiotic use tracking tools available across the continuum of care, I mean, this is not like a tiny thing like just putting a list on the website. This is going to take a long time. What are the tools, especially what are the tools for places like long-term care or nursing homes where it's not always electronic, or there are a lot of challenges. So this is really a big activity and will take some time. Identifying healthcare facility needs for tracking data, benchmarking, and antibiotic use policies. These are all things that they need under the CMS rules. Develop state human antibiotic health goals specific to syndromes and settings. So one example of this is acute respiratory infection, so bronchitis. It's sort of the low-hanging fruit. How much overprescribing do we have for something like bronchitis? So that's just an example of some of the types of goals that perhaps will be set. And utilizing an honor roll recognition system for healthcare facilities. Animal antibiotic stewardship efforts. We want to, number one, at this time, we are planning to support the Veterinary Feed Directive in capacity building, and that's for producers and for veterinarians and for feed distributors. How can we get them the information that they need? How can we get them to understand that they can come to us as this stewardship collaborative and get the information that they need? Participating in and communicating progress on national antibiotic use data collection for livestock. Also a challenge. Promoting producer quality certification practices. Facilitating public engagement on stewardship. Increasing the capacity of the veterinary diagnostic lab. And I should add to this, increasing the collaboration between veterinary diagnostic lab and human public health laboratory. Improving access to stewardship resources for companion animal and equine veterinarians. And this one that will be tricky because there's even less, I would say, general knowledge of stewardship in that sector. And the fourth goal, develop an antibiotic footprint tool and improve the understanding of environmental considerations. The diagram that you see here is just a rough sketch, and it doesn't matter that you can't see the words. The idea is that we are going to try to put together a tool that takes into account all the inputs into the system, all the antibiotic use across human and animal health and perhaps agriculture, to put that into one place to understand how are those antibiotics used, disposed of, and then when they're disposed of, what is the impact on the environment. Ultimately, we would like to develop a risk map for antibiotics in the environment. Why might this be useful? This might be useful in helping to guide environmental sampling for antibiotics and their metabolites in the environment. It might help us to guide sampling for the resistome. Where are we looking for these resistance elements out in the environment? And also, if you take a step back, just being able to put into one place all of the antibiotic use information that we can have about the state can help us target stewardship interventions. We also want to, in this goal, focus on, do we have appropriate disposal options for antibiotics in the state? Are there places where we need to have more options for properly disposing of antibiotics? Okay, so summer and fall of 2016, on July 1st, we had, and all of the commissioners were there, but for some reason I could only find the Commissioner of Health, a photo with the Commissioner of Health, but really everyone was there. And there was a press conference, and the Commissioner of Health, Pollution Control, Department of Agriculture, and the Director of the Board of Animal Health stood together, made comments, and publicly supported the launching of this 5-year strategic plan. Prior to that, by a few weeks, we had posted the One Health Antibiotic Stewardship website. The website is meant to be a place where everyone in the state can come to for information about antibiotic stewardship in their field. The landing page, which is the large photo that you see here, just shows what, it says, what is One Health Antibiotic Stewardship? And it's a place where they can, people can click on what they're interested in, whether it's human, animal, or environmental health, health guidance, or just information. And this website also does have a list of all of the members of that attended the summit. So it publicly recognizes those who participated in this activity. This is just a screen clip from the animal resource page. And so there are links to guidance for all animals, companion animal, equine, beef, dairy, and if you keep going down, poultry and swine. What are some challenges that we have and foresee having for the duration of this? Competing priorities, certainly in all fields. How do we consider the good of the whole rather than the good of individual patients and animals? It's just the basis of this problem, is how do we make a decision and think about the greater good rather than just the individual at that time. How do we define optimal, judicious, and appropriate? This is something we've talked about quite a bit over the last couple days. How do we define this in an evidence-based way? And what are the low-hanging fruit for stewardship in each field? So, for example, in agriculture, perhaps tracking how many producers have had training in a quality assurance program, how many facilities participate in that, how many veterinarians have taken the accreditation modules about resistance and stewardship. How do we know that people are moving towards that, especially when we don't have a lot of data? Which is the next challenge, lack of data. How do we set goals and identify progress, and how can we share data comfortably without feeling as though identity is going to be an overriding issue that allows us not to share? Association does not equal causation, and this is something certainly I think that's sensitive on the animal agriculture side. How can we design meaningful research? We now at this time, November in 2016 in Minnesota, we have a lot of people who are willing to work together. We also have increased funding in the Veterinary Diagnostic Laboratory for antimicrobial resistance. We also have increased funding and a newly identified regional laboratory in our Minnesota Department of Health, Public Health Laboratory. They've been identified by CDC as a antibiotic resistance regional laboratory. We have these resources. Now is the time. But now we need to take the time to stop and say, well, how do we design something that's meaningful, that we can work together and have it be both statistically meaningful, but also meaningful in the bigger sense of where we're trying to go with this. And then communication across fields and also with the public. The next steps briefly are to identify the data sources in all fields. Basically, what is it in your field that you are doing to collect data on either resistance or use or disposal, or what is it, just so that we can get sort of an understanding of what's out there. How do we support health sectors through federal rule changes? You all know about the FDA rule, and now I think multiple people have mentioned the CMS rule that's coming around the bend for human health care and nursing homes. Developing an honor roll recognition system. This is something we've had a lot of requests from healthcare facilities to move forward. Engage the public on One Health. We're planning to do myth-buster messaging about the VFD and also about antibiotic use in animal agriculture. Having stories from producers, veterinarians, and physicians. And having in-person exchanges. We need to refine the methodology for that antibiotic footprint. It's a great idea, but how are we going to do it? And let's get that out there. A collaborative lab-based research by the laboratories in human and animal health, and editing, as Bernadette mentioned, our strategic plan as we need to reflect new data in the new regulatory environment.